Hello everyone, I'm Senator Saud Anwar. I actually have important things that I want to talk about. There will be series of videos that I will have, and this will hopefully have important conversation and perspectives that I understand and I want to share with not only my friends but also people in the community who may disagree with me. I want to start, and this is about vaccines. The first thing I want to mention to everyone is that it is important for us to recognize the fact that the people who are for vaccines and people who are against the vaccines, they are coming from a place of love and respect and love for their children. They are trying to protect their children, so we need to at least unite on that part and respect each other and have good, important conversation in a respectful manner. I think sometimes in these conversations, because the passions are so high, people are moving in directions which are unhealthy for us as a society. So now let's talk about this challenge, this overall broad responsibility that we have. Vaccines have been there for quite some time. We know that. Vaccines have been part of our lives. And the success of the vaccine is their biggest enemy, because for the past 2 generations, people have not seen the ugly face of the infectious diseases that many people in the underdeveloped world see, unfortunately, every day. And then that's why people in one part of the world is asking for vaccines, and the places like United States, our communities, people are saying they don't want vaccines. And that's part of our collective understanding that we have to have. The public health impact. First, we need to recognize that this issue has been one of the most successful public health policies that has been there with respect to vaccinations. This is the biggest success story. But while this is a success story, this is stopping this success story or moving away from vaccination procedures and policies would be a national threat. And why do I say that it's a national threat? Based on the 2009 study, it was very clear that if we were not vaccinating our children in just one cohort, the cost of to the healthcare system in our society would be in the range of about $70 billion, $70 billion. And the illnesses in the children in one cohort, the children that are born in about 4 or 5 years' time, would be about 20 million illnesses that are prevented from this. And that's a very large number of illnesses, and 40,000 deaths are prevented from this. So there's a public health policy impact in just one cohort, and expanded to the entire country over many cohorts of children. That is actually multifold increase of problems. Healthcare systems are not ready to go back to the ages when we did not have the vaccines. So this is a public health. Anybody who's against that and is promoting that is actually creating a public health disaster that our healthcare system is not even ready to address in any shape or form right now. So that's important to keep in mind. It's a national threat to us as a society if we move in that direction. If you look at all the organizations that are out there, again, the American Academy of Pediatrics and American Academy of Family Physicians, American College of OBGYN, and again, the Advisory Committee on the Immunization Practices, CDC, each and every one of them have united around these policy arenas that is based on data, that is based on research. Schools, Board of Educations require children to get immunized. That's what's been going on. If you look at the trajectory in the last year in Connecticut, unfortunately, many of the schools are moving in the wrong direction with respect to the number of children that are immunized. This trajectory is dangerous, and this is moving towards a path which is going to be harmful. That is the conversation, and hoping that in the coming few videos we will be able to discuss why this is important. Why do we need to have a clear policy and look at the pathway where we have to make sure that the people who have medical contraindications that we are aware of, and the ones that we are learning about, we need to protect those children from getting vaccines, clearly. But does everybody need to be out and not get the vaccines? That is not a sustainable model in the current time. And that's why I'm hoping that we'll have a conversation, again, with deep respect to the people who feel on opposite ends of the spectrum with respect to these policies. But in the coming videos, I will hope to converse around these topics. Thank you so much. And then watch the next video.